During times around surgery, it's the perfect opportunity to begin a conversation about a breathing practice. Now, if you're already into a breathing practice, fantastic. I'm gonna show you some ways where you can tune that up and tune it down. But there's a couple reasons I wanna focus on breathing during this time. One is it's a great skill as I sort of maybe have taken myself out of some training modalities, training elements. I can focus on this element of mechanical ventilation, improve some aspect of my fitness that sometimes I may not have time to work on. Two is that I can improve my CO2 tolerance, which means that I can actually go back into my sport a little bit better off. So I'm more capable of stripping oxygen off the hemoglobin, which is one of the reasons that we're into this CO2 tolerance training. But number three, if I can improve my ventilation, then I can actually use the lungs as a bellows to help decongest the body. So, whether it's lower extremity or upper extremity, all of that lymphatic fluid is going to be coming into the superior vena cava, back into the heart. And so it's important to understand that one of those mechanisms of decongesting and moving that lymphatic fluid through the system is ventilation. So being able to move and ventilate is a really good way to sort of pick up the lymphatic movement. So when I talk about breathing and you talk about breathing, we may not be talking about the same thing. So let me show you what I mean in terms of the kind of breath control we're gonna talk about. And I start this with my athletes and I usually talk about it as the 1 rep max breath. So if Mags puts her hand on her stomach, I'm gonna have her take a huge breath into her belly, and her belly should expand up. She's breathing through her nose, and then she's off like a light switch. So big breath in the belly as much as she can, and then light switch, and it relaxes. And what we're trying to do is actually reclaim some of the springiness in the back, springiness in the trunk tissue, so she doesn't have to breathe out per se. Now, so big breath in the belly again, a little further, come on. Further, and let it go. Okay. Second, though, is that we know that the trunk is a radial contractile field, which means that I need to be able to expand in 360 degrees around the spine. So it's not just enough to have my belly go, and which would be working fine if I was just on my back passively breathing, but I need Margaret to also be able to breathe into her ribs on the side. So if this was the Oreo filling of a cookie, she's breathing into the Oreo filling. So take a big breath in your belly. Now breathe into your ribs on the side. Good, and then let it go. Good. So I should see her expand now, belly and ribs. And now we're gonna go belly, ribs, and chest. So see if we can get more air in. And you'll see she's using her hands to do that. Let it go, that's fine. Belly, ribs, and chest. Don't have to do it with the shoulders, just do it with the lungs. But the idea is I want you to feel that those pieces are moving. So belly, ribs, and chest one more time. Expand, 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 expand. Let it go. Good. And remember, her belly should be expanding here because there's no load on the spine. So now we're gonna go belly, ribs, chest, and I want you to feel the back press into the table. Belly, ribs, chest, back. So a little longer. Keep going, keep going, keep going. Can you feel 360? Let it go. Okay. So this way, we've established what we call our 1 rep max breath. Now in our training and loading, we're always looking at integrating breathing. And it's important that we're doing this because as you begin to do some of your early rehab, we want you to understand that if you cannot breathe in the positions you're training, you are signaling to your brain that you do not own the position. And consequently, one of the things that happens is you end up setting up sort of a mechanism in your brain to recognize threat, which is if you are starting to guard or fear guard or be able to kind of hold your breath while you're trying to move, your brain's gonna be like, we don't trust that yet. And it's gonna delay sort of our restoration of our ability to move effectively. So one of the things that we do is like when you're getting out of the bed, if you've had a lower extremity surgery, for example, and you're hooking the leg and swinging out of bed, I want you to breathe through that, shh, or I have to go put my shirt on instead of put my shirt on and deal. I want you to just imagine breathing through those things. So this is a really powerful way to make sure that we don't begin to generate a breath holding pain fear strategy with what's going on with the surgery. Iyengar, classic master yogi, used to say, nerves are king of the breath, breath is king of the brain. So some of the pain may be driving my breathing is driving how my brain is interpreting what's going on. And we have really powerful tools to get in and out of that. So if you find yourself in pain, which likely will be a part of this experience, make sure that you're not doing that breath holding fear kind of breathing, because it's going to continue to kind of map that with pain and threshold. And that's a lot easier said than done, yes? Yeah. Right? So imagine just breathing right through those things. But also, we now have a model to work on decongesting the body. So if I'm laying in bed, because I'm going to need to unload my arm, unload my back, unload my knee, hip, whatever you've done, this is a perfect time to actually work on some breathing drills that are going to make me better at athletics, but also highly decongest the tissues and even potentially hypersaturate the tissues with oxygen. In the hospital, they oftentimes, when people stay a long time or multiple days, they give you a breathing machine or a tube where you breathe into this thing. And the reason is they don't want you to get pneumonia. So what's happening is that people are breathing so shallowly that, and they're not moving, they're not actually decongesting the pleura of the lungs, and so you're likely to get pneumonia. So not only is this good for your decongestion of your limb, et cetera, but also we're going to help prevent pneumonia, which seems really strange that we have to give someone a mechanism to help them breathe. So now we have some ideas about integrating. One, I'm not gonna hold my breath when I have pain. If I need to hold my breath to move, but I'm just gonna make sure I can breathe. Two is that I'm gonna do the first thing that we're gonna apply is what we call our spin up. Now, I like to do this in the mornings, but this is a simple drill to help you do some decongestion of the body, also work on some CO2 tolerance. And this is stripped off of Wim Hof's original model of doing 2 minutes of max ventilation training and then an exhale max hold. Now, if you are a person who it's not appropriate to hold your breath, don't hold your breath. Just do that and then rest for a minute. But for the rest of us, we're gonna exhale on an exhale. We're gonna hold our breath on an exhale rather. Breathe all the way out after we've done this hyperventilation, and we're just gonna wait until we have the trigger to breathe again, and then we're gonna start breathing again. So this is what it'll look like. If I had a clock here, I would say, hey, Mags, I want you to do this for 2 minutes. So take the biggest breath in you can through the nose, let it go, and then right into your next breath. The only thing Mags is gonna keep doing, so keep doing that for 2 minutes, is that I want her to get more air in on the next breath. There we go. More air on the next one. So what you're using this time is getting all this motion. Now look at all this movement that's happening around her spine. Look at all this movement that's happening in the trunk and the belly. The belly should be expanding. So she's getting a ton of motion, which is gonna help move those lymphatics. We're gonna do this for 2 minutes. And if that's too intense, 1 minute is fine. Big breath in for 2 minutes. Just do this max breath hold kind of, or max inhale ventilation volume. And then the last breath that we hit 2 minutes, big breath in, all the way out, and don't breathe again. And what we'd have her do is just hold her breath until she gets Bernie triggering to breathe. She goes right back into her next cycle. Go ahead. And the only thing we care about is not how long you hold your breath, but that you are focusing on this ventilation. That's good. Don't hyperventilate anymore on the table. You may get luminous, you may get heady. That's totally okay. That's just your brain managing with what's going on with scrubbing off the CO2 and maybe some changes in the pH of your bloodstream, which is okay. So here's what we have. This is our spin up, which I want you to do once a day. 2 minutes of that max ventilation where we're really exaggerating. We're not trying to get high on the physiology. We're trying to expand and contract, get the movement going in the trunk. We're gonna do a max exhale hold. So breathe out all the way, and then hold as long as you can, and repeat that 3 to 5 times. So if that could be 2 minutes of max breath hold, maybe you hold your breath a minute, maybe you hold it 3 minutes, we don't care. You're laying down, so if you freak out, just stop. You're on your bed, it's totally okay. Maybe don't do this in the car while you're driving for the first time. This is once a day and makes a huge difference. Even dropping this in throughout the day, if you find yourself in the hospital for multiple days, if you find yourself at home and you're starting to feel congested, boom, throw in a minute of this peak ventilation. Don't worry about the exhales, but you'll see that it makes a big difference in how these tissues are decongested. Now, we want to carry this further on the bike, because ultimately one of the things I'm doing besides moving this congestion, this lymphatic fluid through, is I'm restoring my native ventilation, which is good. something we do work on with all our athletes. But that breath hold, when oxygen is maxed, because I've just pegged it out, and I've scrubbed off the CO2, what ends up happening is I have plenty of oxygen, and then that CO2 is gonna come up high, and what's gonna happen in that situation is that your brainstem is gonna ultimately become more and more comfortable with high CO2 levels. And if you can have higher CO2 levels in your bloodstream, you can strip off more oxygen, which allows you to perfuse tissues more effectively, which is also something that helps you to ride a bike faster or run faster or lift more. So we're huge fans of this anyway from a performance side, and this is a perfect time to start practicing this. And again, this is our daily spin up, which is we've even referenced in our blog and we've talked about for a long time. But on the bike now, because we're huge fans of getting on an assault bike or having a stationary bike, we can start to play around with breath holds. So what I'm gonna show you is that we can, every minute, this is a little breathing on the bike. You're gonna see that one of the things that we like to do is get a lot of zone 1 and zone 2 heart rate, very low, very aerobic, could easily have a chat with your friends while you're biking, or you're just barely moving. We love that on the bike after surgeries and around surgeries, because in that zone 2, we see a lot of stimulation of angiogenesis, which means that's where we're gonna rebuild a lot of the capillaries and decongest the body. So one of the things that we're able to do then is integrate some of these breathing drills while we're pedaling so it doesn't feel so incessant and it's not such kind of low level exercise. And the 2 drills here is, first one is you just do it every minute. So at the top of the minute, you take a 10-second inhale, which is very challenging for people. You have to slow down and take a max inhale while you're doing something on the bike. Then you're just gonna do a max hold on an inhale. All the way hold and go as long as you can, and then repeat that every minute. So a really simple way, every minute, take a 10-second inhale, that'll give you 50 seconds. Do a breath hold as long as you can, that may be 10 seconds, that may be 20 seconds. And then just recover for the rest of the time, and next time the minute comes around, hit it again. Another fun breathing drill is just to take one breath every 5 seconds, and then find out what cadence you can handle to be able to do one breath every 5 seconds. Again, some of this breathing control is gonna force us into maximizing that ventilation and be comfortable with higher CO2s. You can do this walking as well. But we can also flip this on its head and start talking about breathing for relaxing. So a simple way to change heart rate variability, to change blood pressure, is to just start to add in inhales and exhales. So 1 breath or 6 breaths a minute, which would be 1 breath in and out every 10 seconds. That's a 5-second inhale and a 5-second exhale. That sounds like closer to that again. So a 5-second inhale, 5-second exhale, done for 3 to 5 minutes can be very powerful at making you feel better and sort of helping to re-regulate that nervous system, which is under a lot of threat after the surgery. Again, 6 breaths a minute, very easy game to play. And then finally, we can use breathing for pain. And you'll notice that when we had Mags breathe for sort of circulation and power, she's taking this huge breath, letting it go. Big breath in, little breath out. But suddenly, if we want to increase her ability to tolerate pain and help with pain management, we flip the script. We take a big slow inhale, 3 or 4 seconds, and then we take the longest exhale we can, nice and slow, trying to push that exhale to at least 6 to 10 seconds. So it's an easy way, if you're feeling like something's hurting, you're getting out of control, start to take a slow, big breath inhale, 2 or 3 seconds, and then lengthen your exhale, long exhales. And the more you can push the length of that exhale to 10 seconds, you'll see that that's a powerful way to tell your brain it's okay and downregulate that threat response, sort of interrupt how the brain is thinking about or perceiving what's happening in the tissues. Remember, it doesn't matter what surgery you've had, your tissues do not generate pain. What happens is your brain interprets what's happening in the body as a pain signal. So anytime we can throw movement in there, that's one of the things that's happening. Anytime we can throw a different signal to the brain or interrupt the brain's interpretation of what's happening, might be a way to feel better. So again, 1 rep max breath, it's this radial contractile field. We have our spin up model, some games we can play on the bike. Hey, if I need to relax, I take 6 breaths a minute. If I want to manage pain, I start to lengthen my exhales. And this is a powerful way to help decongest the body, get something out of this breathing time while I'm also working on sort of rebuilding my CO2 tolerance so I can go out and return to sport. I can also relax and help manage pain at the same time.